Healthy babies are hardwired to breastfeed. Hardwiring is a term that neuroscientists use to refer to the reflexes and the instincts built into that baby's body and brain. We are mammals. Squirrels, cats, and dogs all breastfeed their babies. We are no different. However, somewhere along the line, we've learned that it's difficult to breastfeed. Let's watch now as we see a baby crawling to the breast and self-attaching all by itself.
For the first 30 minutes, the baby will be alert and look around. He will touch, feel, and smell his surroundings. The baby will then begin to kick and move his feet, move his shoulders, hands, and body. The baby will start smacking his lips, bringing his fingers to his mouth. He will then start salivating. The newborn's ability to smell is well developed at birth. The smell of the amniotic fluid on his hands will help him to locate his mother's nipples, which have a similar smell. Using his sense of smell, the baby will move towards the nipple, usually by bobbing his head, pushing his legs, and moving his shoulders and arms to position his mouth on his mother's nipple. Even with his limited vision, the baby can see the areola and will move towards it. When the baby reaches the nipple, he will raise his head and with a wide open mouth, attach to the nipple and start to suck.
So let's look at what supporting a breastfeeding mom entails. One, you want to understand what normal breastfeeding looks like, how it should feel, and what a proper latch is. Stay close just in case she needs your help, but let mom and baby work together. And know what resources are available. This might be something that you could look into prior to the birth of the baby so you have a team at hand should you need it. How can you support the breastfeeding mom at that moment of birth? You can hold that space for her in the room. Just keep people away and keep that baby skin to skin on the mom if you can. But also, if mom is busy and there's a complication, you can ask the dad to take his shirt off and hold the baby skin to skin so the baby gets the benefit of that even if mom is not available. Mother's body is baby's natural habitat. We know that babies who are skin to skin in the first 2 hours after birth are more likely to latch on and breastfeed well. They cry 2 to 10 times less. Their blood sugars and temperatures are much more stable. And early skin to skin has been shown to increase breastfeeding duration. Another role that you could play is to ask the staff to delay those newborn routine procedures until after that first uninterrupted breastfeeding. Your job is to encourage the mom to just trust her baby's instincts. Another thing that you can do is to limit the visitors for the first couple hours, just giving mom and baby bonding time. You really want to start with a calm, alert baby. Use mom's body to calm that baby. You do this by just putting a baby that may be a little fussy and not ready to latch on vertical between her breasts and calm and soothe the baby, and then let the baby take the lead. It's really important that your baby get on the breast well because it prevents sore nipples, blisters, bleeding, cracked nipples, and a good latch means the milk is transferring well from mother to baby. You don't take a big hamburger and go to take a bite out of it like this. You take a bite out of it like this. What happens is the chin needs to go into the breast, the nose and the nipple meet and the baby opens wide and latches on just like you take a big bite out of a burger. That's what we want for that baby, is to get that chin in and then the mouth out so that the nipple points toward the back of the mouth. A good latch is essential and it takes practice. Find a lactation counselor or consultant in your area to have a consult with if the latch seems to be a problem. Let's look at the feeding cues. When a baby has closed fists, even while sleeping, they're getting ready to eat. Rooting, everybody's seen a baby root. Maybe you've held somebody else's baby and they were hungry and they started to kind of latch on to your sleeve or your arm or your chin because they're hungry. So rooting is a sign that the baby needs to eat. Hand to mouth movements. They put their hands to their mouth and they kind of lick and smack their lips, and this is a sign that they're interested in feeding. When a baby is asleep, babies typically go into a deep sleep early on, and then as they start to wake up, they have the rapid eye movement or the REM sleep. So when you're seeing a baby sleeping and you can see eye movement underneath the eyelids, that would be a good time to pick that baby up and latch the baby on. Crying is the last cue. Unfortunately, it's difficult to get a baby to latch on when it's crying. This is again where you put the baby vertical between the breasts and you soothe and calm the baby, and then you try to attach that baby.